Hello and welcome back to Unacademy. So let's crack NEET PG. Myself, Dr. Muskan Chaudhary, and today we'll discuss a short topic that is Corynebacterium diphtheria. We'll just quickly cover up the theory session of the Corynebacterium diphtheria, and then we'll cover the question answers of the bacillus in the Clostridium, the topics that we have already covered. All right. So starting with the Unacademy. Unacademy is what India's largest India's largest learning platform where you can access both the live and the recorded sessions, and you can access your recorded session anywhere and everywhere. That to learning from the India's topmost educators for any medical examination, be it NEET UG or NEET PG examination, and personalize your learning experience with your favorite educator. Compete in the live TNDs and test your preparation with a highly competitive examinations. Study on the device of your choice and assess around about 25,000 of the MCQs. Our main motto is to cover around 50 to 100 MCQs per day, 50 to 100 MCQs per day, and soon the printed and the digital notes will be provided to you guys. Icon subscription, that is something that is new, in which the Unacademy has come together with the prep ladder and clinical and the integrated essentials with the video lectures, QBanks, rapid revision notes, and treasures, and the dream notes on the prep ladder with the well structured live batches, recorded classes, and the QBanks of around 25,000 MCQs, competitive TNTs, and comprehensive and the printed digital notes of the Unacademy. And do use my code, that is what? That is Muskan 10 to get 10% of the discount, and for 24 months it will cost you around 36,000, 36,000 around 1,500 per month, and 58,500 for around 24 months for icon subscriptions, that is 2,438 per month. Raise a hand feature, that something is new and specific for the academy, so that you can personalize and make your classes sessions highly interactive, live session for educators as well as for the learners, so that you can engage into one-on-one doubt solving sessions and in the quizzes and the vivas and the doubt solving sessions with your favorite educators. All right. Upgrade highly effective Q banks up to 25,000 of MCQs based on the latest examination pattern. And special class features includes interactive live classes. You can attend live class, participate in the live chat, and get your doubts cleared. Respond to the polls for a better understanding of the topic, and raise a hand, talk to educator, and get your doubts resolved in the real time. And never miss a class, because you will get the notification for the same, and you can download the lecture notes and get access to recorded sessions of the live classes anytime and anywhere, and participate in the live chat and get your doubt cleared all during the classes. Alright, for the 24-month subscriptions, 4 month is totally free, and with 12-month subscriptions, 2 month is what? Totally free, and use code, that is Muskan 10 to get what? 10% of the discount, 10% of the discount. We'll start with the gram positive route. We'll start with what? We'll start with Corynebacterium. Corynebacterium diphtheria. Corynebacterium diphtheria, that is also known as what? Klebs, bacillus. Okay. So what is the other name for the Corynebacterium diphtheria? That is what? That is what? Klebs, bacillus. All right. When we talk about the Corynebacterium diphtheria, when we talk about the Corynebacterium diphtheria, they are what? They are gram positive. They are what? Gram positive rods that are what? Club shaped. That are club shaped. Alright, and they are what? They are non-capsulated, non-capsulated and non-sporing. Okay, non-sporing. We have only two spore forming, two spore, that is B and C, that is what? Bacillus, and Clostridium. Okay? And Bacillus is have what having the non-bulging spores, and the Clostridium have what bulging spores. Okay, now they are what non-capsulated and the non-sporing, and they are what facultative and arrow, and all of them divide because of what binary fission. So the important point to remember here is what that is, they are also known as Klebsiella bacillus, and they are what non-capsulated and non-sporing. Now, they are what arranged in, very important, they are arranged in V, L or I letter form. That is what Chinese letter arrangement, or cuneiform arrangement, or cuneiform arrangement. Again, an important question, that is Chinese letter arrangement or cuneiform arrangement is seen where? That is Chinese letter arrangement or cuneiform letter arrangement, or V or L or I, is what it is what seen where in the Klebsiella bacillus or Corynebacterium diphtheria. That is, they are having what granules, and these granules are what the general characteristic, that is what they contain, they contain intracytoplasmic, this what metachromatic granules, metachromatic granules that is also known as volutin granules, or bipolar granules, or Babes Ernest granules, or polymeta phosphate granules, phosphate granules. And so, what are the other names of the granules? They are metachromatic granules, the volutin granules, the bipolar granules, the Babes Ernest granules, or polymetaphosphate granules. Now, when we talk about the granules, initially they were stained by what? They were stained by polychrome, polychrome methylene blue stain. Okay? Initially, they were stained by what? Polychrome methylene. Initially, they were stained by polychrome methylene blue stain. Although now polychrome methylene blue stain is all majorly used for the McFadden reaction, for the staining of the capsule of the Bacillus anthrax. But it takes several hours. Since it takes what? Several hours. Therefore, what are the methods that are used? That is NAP. That is what? That is Neisser stain, Albert stain, and what? And Ponder stain. Okay, so granules, they were stained by polychrome methylene blue stain initially, but since it takes hours, now we use Neisser stain, Albert stain, and the Ponder stain for the staining of the polymeta chromatic granules or polymetaphosphate granules, Babes Ernest granules, or bipolar granules. Now we'll talk about the biochemical reactions. Okay, we'll talk about the biochemical reactions. They are catalase positive. What else is catalase positive? Very important. That is Staphylococcus. That is catalase positive. Listeria is also catalase positive. They are what? They are oxidase positive, and they ferment sugar. They ferment what? Sugar. Okay, so they are what? Catalase positive. They are oxidase positive, and they ferment sugar. And they ferment sugar in the his serum. sugar solution. That is again important question. That is they ferment sugar and the his serum this sugar solutions, that is they are fermenting what sugar. Now, when we talk about the culture, when we talk about what are the important points that we have read till now, key the other name for the Corynebacterium diphtheria is Klebsiella bacillus, and they are non-capsulated. Plus, they are arranged in cuneiform letter arrangement or Chinese letter arrangement, and the granules that we stain by NAP, that is Neisser stain, Albert stain, Ponder stain, and they ferment sugar in his serum sugar solution. Now, when we talk about the culture, they only grow on the enriched media. Okay, and rich media, because they are what fastidious bacteria. Okay, fastidious bacteria means these bacteria will need additional nutrition for its growth. They will not grow in simple media. They will not grow in the simple culture media. So they will grow what? They will grow in the enriched media. And what is the enriched media that we use for the Corynebacterium diphtheria is what? Loeffler's serum slope. What we use for the enriched media, we use for the Corynebacterium diphtheria is what? Loeffler's serum slope. Is what? Loeffler's serum slope that we use for the Corynebacterium diphtheria, and colony will appear in 6 to 8 hours. Please remember the name that of the culture media that we use is what? Is the Loeffler's serum slope media, that is what? Enriched media for Corynebacterium diphtheria, for Corynebacterium diphtheria. Now, what is the selective media? This is the enriched media. One enriched media that we are using for the Corynebacterium diphtheria. We'll talk about now. We'll talk about what the selective media. And what is the selective media? Though terms there, one was a selective media and another was the enrichment media. And what was the basic difference? Selective media was solid in nature, and enrichment media, they are liquid in nature. Okay, and both are the same. That is, they are consisting of the inhibitory substance that inhibits the growth of other microorganism and helps in the growth of the particular organism that we need to culture. All right, so what is a selective media? Selective media is what? Potassium telluride agar media. Okay, what is that? Potassium telluride agar media, that is a PTA media, and the color will change to black colored colony formation, black colonies formation, and it is due to the reduction of the potassium telluride to black tellurium. Okay, it is due to reduction of the potassium telluride to tellurium. And PTA is also differential media. PTA is also differential media. Why? Because we can differentiate the Corynebacterium diphtheria in gravis, intermedius, and what is mitis. Okay, we'll see further how we differentiate. It is the selective media as well plus differential media as well. Differential media ka matlab ye we can differentiate the bacteria on the basis of the color morphology of the colony, and we can differentiate the gravis, intermedius and the mitis, because mitis matlab hota hai matte color. So the colonies will show what? Black matte color on the colony. Okay, and the intermediates will show the intermediate color between gray to black, and they are small gray colonies. Gray colonies. Grayish means what? They will show what? Small dull gray colonies. Intermediate is what? Intermediate color between these two, and the mites is what? Black matte color. Black matte color. Now we'll talk about. Yeah, hi, a very good evening. Okay, so now we'll talk about the virulence factor. We'll talk about the virulence factor. अभी तक हमने क्या क्या इंपॉर्टेंट चीजें पढ़ ली। क्लैप्स लॉफ्टर्स बेसिलाई होता है, मेटाक्रोमेटिक ग्रैनुल्स, बाइक्रोमेटिक ग्रैनुल्स एंड बाइपोलर ग्रैनुल्स, चाइनीज और यूनिफॉर्म लेटर अरेंजमेंट एंड शुगर fermentation plus and Loeffler serum slope is the enriched media and selective media is what PTA is what PTA. These are the key points that you have read till now. Now coming to virulence factor, the first virulence factor is what diphtheria toxin. What? Diphtheria toxin. The first valence factor is what? The first valence factor is the diphtheria toxin that is responsible for what? For both, that is what? Local as well as systemic infestation. ठीक है, so diphtheria toxin that is responsible for systemic as a local infestation, although the bacteria itself is what? Minimal invasive. ठीक है, again this is what that is question, that is it is what? Minimal invasive, and it is both causing local as well as systemic infection. ठीक है, and it is what? Very important, it is bacteriophage. It is what? Bacteriophage encoded toxin. And what was the mnemonic for the bacteriophage encoded toxin? What was the mnemonic for the bacteriophage encoded toxin? That was A, B, C, D and E. ठीक है, जिसमें से A was standing for the Shiga toxin, B for what? Botulinum toxin, C for what? Cholera toxin, D for what? Diphtheria toxin, and the E for what? That is the enterotoxin of the streptococcus. These all are what? These all are what? Bacteriophage encoded. These are all what? Bacteriophage encoded. That is A, B, C, D, and E. A, B, C, D, and E. Alright, and this bacteria toxin requires higher level of iron for its activity. ठीक है, it requires the iron, the better the level of the iron and better the toxin will act, and it acts in both for the local systemic infestation and minimally invasive. And A, B, C, D, E, that is what? That is the mnemonic to remember the bacteriophage encoded toxin. Bacteriophage encoded toxin. Now, apart from the diphtheria toxin, produced by what? Corynebacterium diphtheria. What else can also cause the diphtheria toxin? It is also caused by the ulcerans, and what else? Pseudo-TB. So apart from the Corynebacterium diphtheria, the ulcerans as well as the pseudo-TB, is also can cause what? Release what? The diphtheria toxin. Now we'll talk about the toxin structure. Okay, structure consisting of the A and the B subunits, and the receptors to which it mediates. What are the receptor? Is what? H, B, E, G, and F. That is what? That is heparin binding, epidermal growth factor. Although if you cannot remember, just forget this what is HBEGF. Just remember that it consists of two subunits. That is A and B subunits. That is what? A and B subunits. Now all the cells of the body, are susceptible to what? To the diphtheria toxin, but not except for what? Except for RBCs. Except for what? RBCs. Except for RBCs. Okay, so all are susceptible to the diphtheria toxin, but not the RBCs, but not the RBCs. Now we'll talk about. Okay, now we'll talk about the mode of action that is important to remember. Mode of action that is important to remember. देखो ये कैप्सुलेटेड तो है, तो वैलेंस फैक्टर इसके पास सिर्फ टॉक्सिन है जो कि डिप्थीरिया टॉक्सिन है, एंड वी नीड टू रिमेंबर द मोड ऑफ एक्शन. वी नीड टू रिमेंबर द मोड ऑफ एक्शन, दैट व्हाट इज द मोड ऑफ एक्शन ऑफ द डिप्थीरिया टॉक्सिन. दैट इज जब भी ए और बी दो सब यूनिट है किसी भी टॉक्सिन में, यू नीड टू रिमेंबर दिस बी से बी दैट इट विल बाइंड. ठीक है, इट विल बाइंड विद द होस्ट सेल, इट विल बाइंड, दैट इज बी का फंक्शन है, दैट इज टू बाइंड. एंड ए सब यूनिट विल गो इनसाइड द सेल एंड इट विल व्हाट, इट विल कॉज द इट विल एक्चुअली cause the inhibition of the elongation factor 2 that is required for the protein synthesis. Therefore it will inhibit what, the protein synthesis. It will inhibit what, the protein synthesis inhibition. Okay, and what else, bacteria also causes the inhibition of the elongation factor 2 that is inhibiting the formation of the protein in the host cell. So we need to remember the list of the bacteria, that is what, D for diphtheria toxin, S for Shiga toxin, and P for Pseudomonas. For Pseudomonas. How to remember it? If you remember the mnemonic for this, if you remember the mnemonic for this key, which bacteria doesn't synthesize protein? That is, don't synthesize protein. Don't synthesize protein. That is D, diphtheria toxin, synthesize Shiga toxin, and P for Pseudomonas toxin. That is, they are what? They are what? They are inhibiting the elongation factor 2, and they are inhibiting what? They are inhibiting the formation of the protein. That is, they are inhibiting what? Protein synthesis inhibition. All right. So this was about the toxin. The toxin is very important. We need to remember that two subunits, and very important that it is inhibiting the elongation factor 2 and inhibiting the protein synthesis. Apart from the diphtheria, Shiga and the Pseudomonas toxin is also inhibiting what? A protein synthesis. Now, now we'll talk that on the basis of morphology, on the basis of the morphology and the culture. On the basis of the morphology and the culture, the three main biotypes of the Corynebacterium diphtheria, that is what, that is gravis, intermedius, and what is mitis. Okay, gravis, intermedius, and mitis. Now, when we talk about the morphology, gravis, they are what? They are short rod with few granules. With few granules. They are what? Short rod with few granules. And intermedius, that is what? Long rods with few granules. They are what? Intermediates are what? Long rods with few granules. Now mites, they are what? Long rods with abundant granules. Abundant granules. ठीक है? That is what gravis is what? Short rod with few granules. Intermediate is long rod but granules are still few, and mites, this is what? Long rod with abundant granules. And how does the colony appear on the blood agar? Colony on the blood agar, how does it appear? That is what? Daisy head appearance. Daisy head appearance. And it is what? Frog's head appearance. Frog's head appearance. And it is what? Poached egg appearance. If something is there that we need to learn in the biotypes, if something is there that we need to learn from the biotypes, then we need to remember the colony. How does it appear? It appears the daisy head. Remember the daisy head gravis? frog egg, frogs had intermediates and post post mites. ठीक है, post mites frog is intermediates and the daisy head gravis. All right. And when we talk about the starch fermentation, glycerol and the starch fermentation, that is what positive in case of the gravis only. Okay, so starch fermentation that is in the gravis. So daisy gravis and the frog intermediates and the post mites on the post mites. The colony morphology on the potassium tellurate agar we've already discussed. The mites will be matte color, that is the black colored colonies, and the large colonies. Intermediates will be the color will be intermediate between gray to black, and the they will appear the long rods with the intermediate color, and the gravies they will be dull gray color and they will be short rod colonies on the PTA agar. So we have discussed about that. Now we are left with the complications. We are left with the complications. Now, what are the complications? The daisy head gravis, that is a this gravis daisy is what complication is what paralytical and the hemorrhagic complications, and hemorrhagic complications in the intermediates and obstructive complications where in the post type हुआ है शायद मेरे कमरे में anyways ठीक है ठीक है so gravis intermediates and mites. The one thing that we need to remember is the other name the colony on the blood agar daisy gravis intermediates frogs and the post mites. Other thing we need to remember that how they appear on the PTA agar. ठीक है now coming to the disease diphtheria is what strictly human disease. Diphtheria is what strictly human disease. It is what strictly human disease that is transmitted by aerosol or air droplet form. ठीक है and what is the incubation form? It is around 3 to 4 days. It is around 3 to 4 days. And what is the common age is about in the children, that is 2 to 5 years. And what is the most common? So what is the question that is asked? एक question जो पूछ जाता है, that is it is a strictly human disease. And what is the most common type? Most common type is what? The swollen neck, that is what? Posterior diphtheria membrane that is formed, that is what? Swollen neck, that is what? Bull's neck, that is what? Bull's neck. Now the question that is asked, that it is one is this strictly human parasite, and dusra the swollen neck, that is the bull's neck, is the most common type, all right. And what all does it involve? ठीक है, that is नाक, कान, गला, all, that is nasal symptoms, otitic as well as conjunctival. All right, and what is the most dangerous type? That is what most dangerous is what? Meningeal. So swollen neck and the bull's neck, that is the most common type. Other than the nasal, otitic, and the conjunctival areas are also involved, and the most dangerous is obviously meningeal one. Now, what is the characteristic? What is the characteristic for the diphtheria? What is the characteristic for the diphtheria is what? Pseudomembrane formation. Is what? Pseudomembrane formation where in the posterior pharynx. In the posterior pharynx. ठीक है? Pseudomembrane formation in the posterior pharynx that will bleed on touch. ठीक है? Posterior pseudomembrane formation in the posterior pharynx that will bleed on touch. Alright, so please remember this is a characteristic and this will bleed on the touch. This will bleed on touch. Now 30% of the patient who are untreated, the 30% of the patient will die due to complications. And what is the most common complication that is resulting to death is again question. This is due to the myocarditis, is mainly due to the myocarditis, is due to what? Is due to myocarditis. If the person is dying due to the untreated case of the Corynebacterium diphtheria, then the most common cause is what? Most common cause is myocarditis. What are the other complications? What are the other complications of the diphtheria? That is one is what? Hemorrhagic complications that will include the epistaxis, purpura. Other than this, the pseudomembrane can obstruct the airways. That is what? Obstructive airways. के अलावा most common cause of the death, that is the myocarditis, and it comes along with the AV block. It comes along with the AV block and the arrhythmia. And other than this, the neurological symptoms, the neurological occurs mainly due to the demyelination. It mainly occurs due to the demyelination of peripheral nerves. It appears with the demyelination of the peripheral nerves, and this will include the palatine paralysis, the oculomotor paralysis, or the ciliary paralysis, or the paralysis of the extremities. So, what are the points that we need to grab from the here? Where the questions are that characteristic is the pseudomembrane formation that bleeds on touch, and the most common cause of the disease in untreated cases of the diphtheria is due to myocarditis. Myocarditis. All right. Now, how do we do the diagnosis? We do the diagnosis either by the swab collection, or the pseudomembrane is there for throat swab collection, and we do what the gram stain, and we do the Albert stain, nasal stain, Ponder stain to check for the granules, and then see in the selective media, that is the PTA agar. And one we also do the test, one we also do the in vitro test. That is, what is the name of the test? Important one, that is Alex gel precipitation test, or it is also known as immuno precipitation test, or immunodiffusion test, or double diffusion in 2D. This test is to check for the toxigenicity. That is, it is what toxigenicity test. It is what a filter paper strip, and it is a toxigenicity test to check for the toxigenicity and the toxin of the diphtheria, and having the positive and the negative control. That is the Alex gel precipitation test, or immune precipitation test, immune diffusion test, or double diffusion in the 2D. Other test we can do is what Schick test, and that is to see the susceptibility of individual to diphtheria. This is to check for the susceptibility of individual to diphtheria. And what is the treatment? What is the treatment is what anti diphtheria toxin, that is anti diphtheria toxin and penicillin. Plus, isolate the patient, because the aerosol is the mode of the transfer of the this diphtheria. That is, isolate the patient and treat with the anti-diphtheria antitoxin or the penicillin. So, what are the key points that we need to remember? And the repetitive questions are being asked is that key. First, we'll come to the First, we'll come to the name. The name is a Klebs Loftus bacilli, and they are non-sporing. Arrangement, we need to remember they are arranged in the Chinese letter arrangement or the cuneiform arrangement. And the granules के क्या क्या नाम थे? One is the metachromatic granules, metaphosphate granules, and this bipolar granules. And what are the stain that Babes Ernest granules, and the stain that we use is by mnemonic and AP, that is Neisel stain, Albert stain, Ponder stain. And what else? It was catalase positive oxidase, but remember that they do the sugar fermentation in the his sugar serum test. And enriched media, that is what? Enriched media is Loeffler serum slope. And what is the selective media? That is the PTA media. And potassium telluride, that reduces to the potassium tellurium. On the basis of that reduction, PTA is also differential media, क्योंकि उसके basis पे हमने intermediate gravis और mitis को differentiate किया था. And mitis, from the name, that is they are matte black. Intermediate is in between the gray and black, and the gravis, that is gray. All right. And one we need to remember, gravis is showing the daisy head colony, and the intermediate frog, and the post in the mitis. What else? The toxins, the diphtheria toxins, that is what? Bacteriophage encoded. And the mnemonic for the bacteriophage encoded was A, B, C, D, and E. uh, Two subunits A and B. B for B, that is binding, and A will activate and it will inhibit the elongation factor 2, and that will inhibit the protein synthesis. What else inhibited the protein synthesis? That is don't synthesize protein. D for diphtheria, S for Shiga, and P for Pseudomonas toxin. Alright. Strictly human parasite mode is aerosol air droplet, and pseudomembrane is the characteristic on the posterior pharynx, that is the bull's neck, is the most common symptom. And if the death is occurring in the untreated case of the Corynebacterium diphtheria, then it is due to myocarditis. Myocarditis. All right. Complication is the pseudomembrane blockage the airway, so obstructive complication, myocarditis. And the meningeal complications, hemorrhagic complications. In vitro test we did was the Alex gel precipitation test, immunodiffusion test, or the double diffusion test. For the treatment, we gave the anti-diphtheria toxin and the penicillin. So we'll come to the question answers now. We'll discuss question answers on the bacillus and the clostridium that we need to complete, because we have just covered the theory session of that topic. So we'll quickly cover the question answers for that. Okay, now first we'll come to the first question. Now I'll give around 30 seconds, 20 seconds for each and every question. So you can just let me know in the comment section. So the first question, Clostridia are, they are what? Gram positive aerobes, they are gram positive obligate aerobes, they are gram negative rods, or they are gram negative bacillus. So what is the answer in this? The Clostridia are what? The Clostridia are what? They are gram positive obligate aerobes. So what is the mnemonic for the gram, for the obligate and aerobes? That is A, that is the actinomyces, that is again a gram positive. Then bacteroids, bacterios, that is the gram negative, and what? Clostridium. These are what? These are what? These are what? The obligate. These are what? Obligate and aerobes. Okay. So these are what? Obligate and aerobes. Now coming to the next, that is Non-motile Clostridia are what Clostridium perfringens, novae, botulinum or difficile. Botulinum or difficile. What is the answer? So non-motile Clostridia. Now, non-motile Clostridia, although we need to remember that Clostridia, generally the Clostridia is having what? Peritrichous flagella. Okay, Clostridia is having what? Peritrichous flagella. Alright, so they are what? They are motile. So they are motile, but but Clostridium perfringens and Clostridium tetani type 6. They are what? They are non-motile. So which one is the non-motile? Clostridium perfringens and Clostridium tetani type 6. Now, oval bulging terminal spore. Oval bulging terminal spore is found where? Oval bulging terminal spore is found where? Clostridium tertii, velchi, perfringens or histolyticum. So what is the answer? Oval bulging terminal spores. If you remember, only two bacteria are spore producing. एक तो bacillus होता है, एक क्लोस्ट्रीडियम होता है. लेकिन बी से बी नॉन बल्जिंग होता है. ठीक है. And clostridium have what? Bulging spores. Okay, and now we are talking about the terminal spores. Terminal spores we talked about, one is the oval and the terminal spores, that is the similar to the appearance of the tennis racket. That is what tennis racket bulging spores they are present with. They are present in the Clostridium difficile में होते हैं एक तो, और दूसरा Clostridium tertium में. ठीक है, that is the Clostridium tertium. And the terminal spores that are what? That are what? Similar to that of the drumstick appearance, and they are circular. That is what they are, what? Circular. किसमें present होता है? Clostridium tetani में. Now, subterminal spores are found at Clostridium sordely, Clostridium sporogens, Clostridium difficile, tertium, or botulism. Now, PGI question, so multiple choice is true in this case. So, multiple options are true in this case. So, subterminal spores are found where? So, subterminal spores are found where? It is found in Clostridium sordely, Clostridium sporogens, Clostridium difficile, and the Clostridium botulinum. Now, for the subterminal spores, remember that most of the spores are in the Clostridium are what? Subterminals, but the option tertium and the difficile, and if you remember, the subterminal spores mainly present in BHMS copronym BHNS kata. That is what Clostridium botulinum, Histolyticum novi, and the septicum. Other than this, even the Clostridium perfringens is also having the subterminal spores. What is the best treatment? What is the best treatment for the contaminated wound with a necrotic material, that is anti-gas gangrene serum, debridement antibiotic, or the tetanus toxoid, or the tetanus toxoid? So what is the best treatment for the contaminated wound with the necrotic material? So what is the answer? What is the best treatment for the contaminated wound with a necrotic material? Now, when the wound is contaminated with the necrotic material, we first do the debridement. We first do the surgical debridement. All right. Now, gas gangrene are caused by the Clostridium novi, septicum, histolyticum, perfringens, or the titne. So, gas gangrene is caused by. So gas gangrene, multiple options are correct in this case. If you remember the gas gangrene, what is the most common agent for the gas gangrene? It is what? Clostridium perfringens. क्या है? Clostridium perfringens. Other gas gangrene causing agent are PNSH. That is Clostridium perfringens, Clostridium novi, Clostridium septicum, and sometimes Clostridium histolyticum. So, gas gangrene causing agents are what? PNSH. Okay, so Clostridium novi, septicum, histolyticum, and the Clostridium perfringens, Now, coming to the next question regarding Clostridium perfringens, the gas gangrene. False statement is it is a common cause of the gas gangrene. The Nagler's reaction is positive. The most common toxin is hyaluronidase, and the food poisoning strain of the Clostridium perfringens produces heat-resistant spores. So, which of the following is false? So, regarding Clostridium gassing, which of the following is for? It's a common cause of the gassing. This is absolutely true because P and SH are the common causes of the gas gangrene. Nagl's reaction is positive. This is also because Clostridium perfringens. What is the important point? कि एक तो वो target hemolysis show करते हैं, target or the double zone of the hemolysis, plus they are the most common cause for the gas gangrene, and they show what? Nagler's reaction पॉजिटिव, क्योंकि क्लोस्ट्रीडियम परफिंजेस में दो तरह के टॉक्सिन्स होते हैं, वन इज मेजर एंड अनदर इज व्हाट? माइनर. माइनर टॉक्सिन एंड मेजर टॉक्सिन दैट इज अल्फा बीटा, ठीक है, एप्सिलॉन एंड ईटा, ठीक है, एप्सिलॉन एंड ईटा एंड अल्फा इज द मोस्ट कॉमन टॉक्सिन. व्हाट इज अल्फा? अल्फा क्या है? अल्फा इज व्हाट? लेसिथिनेस टॉक्सिन. इसके लिए अपन Naglers reaction करते हैं, ठीक है. So Naglers reaction is positive. This is true. Food poisoning strain produces heat resistant spores. The Clostridium spores are killed at 100 degrees Celsius, but the Clostridium perfringens और क्लोस्ट्रीडियम बोटुलिनम। ठीक है, इनके स्पोर्स 100 डिग्री सेल्सियस पे डिस्ट्रॉय नहीं होते हैं, दैट इज दे आर हीट रेजिस्टेंट स्पोर्स एंड दे आर किल्ड एट 121 डिग्री सेल्सियस. So this is also true. And most common toxin is what? Alpha toxin, that is lecithinase toxin. That is lecithinase toxin. Coming to the next question, GIT enteritis necroticans is caused by GIT enteritis necroticans is caused by the deficit Perfringens, botulinum, Campylobacter jejuni, or the Pseudomonas. So what is the answer? GIT enteritis necroticans is caused by GIT enteritis necroticans को अपन क्या कहते हैं? Pig bell disease भी कहते हैं. It is also known as the pig bell disease. Is nothing but necrotic enteritis, and it is caused by type C strain of the Clostridium perfringens. Two types mainly we read, that is type A and type the C, and the type A is mainly responsible for causing the food poisoning, that is having the symptoms of what? Diarrhea, and type C for the pig bell disease, important one, that type C is responsible for causing what? The pig bell disease. How to remember this? C ऐसे लिखेंगे, and this is what? The P. ठीक है, it is responsible for causing what? Pig bell disease. Coming to the next question, the following statements are true regarding the Clostridium perfringens, except it is the commonest cause of the gas gangrene. It is normally present in the human feces, and the principal toxin of the perfringens is the alpha toxin, and the gas gangrene producing strain produces the heat resistant spores. So, which of the following is not true? So, which of the following is true regarding the Clostridium perfringens? Which is not true. Now, it is the commonest cause of the gas gangrene. Yes, P and S H. P is the most common cause. So this is true. Okay. It is normally present in the human feces. Yes, Clostridium is present normally in the human feces. And the principal toxin is alpha. Just now we read ki the two types, major and the minor, and the alpha is the most violent toxin in the Clostridium perfringens. Now, although the Clostridium perfringens and Vitilicum, they have the heat resistant spore, but the gas gangrene strain of the Clostridium perfringens produces the heat labile spore. If we do not remember it, but we know that it is the most common cause of gas gangrene. They are present normally in the human feces, and it is the alpha toxin that is mostly the alpha toxin that is the most violent toxin of the Clostridium perfringens. Coming to the next question. Now, regarding the gas gangrene, one of the following is correct. It is due to Clostridium botulism. Clostridia species are the gram-negative spore-forming anaerobes, and the clinical features are due to release of what? Protein endotoxin, and gas is invariably present in the muscle compartments. So, which of the following is true? So which of the following is true? It is due to the Clostridium botulism. No, Clostridium botulism doesn't cause the gas gangrene. Okay, and they avoid gram-positive spore-forming anaerobes, and the clinical features are due to release of the alpha toxin major. That is what, not a protein endotoxin. Gas is invariably produced where? In the muscle compartments. This is true. Gas gangrene results from the Clostridia invade the muscles, producing the abundant toxin, resulting in what? Extensive necrosis of the muscle compartments. And gas gangrene is due to the Clostridium perfringens. They are what? Gram-positive spores, and the gas gangrene is due to release of the exotoxin, and it is a gram-positive, therefore it cannot have the endotoxin activity. What is the most appropriate way to prevent the gas gangrene? That is antitoxin, prophylactic parenteral antibiotics, or extensive debridement or limb amputation. What is the most appropriate way to prevent the gas gangrene? Okay, what is the most appropriate way to prevent the gas gangrene? Now, when the gas gangrene, the most appropriate treatment is what? Is what? Surgical debridement with what? Surgical debridement with hyperbaric oxygen. Okay, why the hyperbaric oxygen is given? Because the gas gangrene producing Clostridium is obligate and aerobe, and to prevent the further infection of and the extension of the gas gangrene, we do the debridement to clear out that gas gangrene zone, and to give the hyperbaric oxygen to inhibit the growth of further toxin released by what? Toxin released by the Clostridium perfringens. The prophylactic parenteral antibiotics are not that appropriate because the toxin has been already released, and therefore we need to treat the gas gangrene that has been caused. Now, surgical debridement is a mainstay. What is true? True about the gas gangrene is what? It is underlying skin and the muscles are normal, caused by the titanospasmin toxin. Muscle rigidity and the spasm are the characteristics. Most common organism is perfringes, and passive immunization doesn't help. So which of the following is true about the gas gangrene? So which of the following is true? Underlying skin and muscles are not normal. This is gas gangrene is mainly Clostridium tetani doesn't cause the gas gangrene. The agents are P and S, H, perfringes, novae septicum, and histolyticum. Muscle spasm, this is not the characteristic. What is characteristic? Crepitus. Crepitation and पेन एट द साइट ठीक है पेन एंड द पट पट crepitations की आवाज ठीक है so they are characteristic most common organism is the perfringes ठीक है so most common organism in the gas ring is perfringes and that is mnemonic P and SH in the sequence underlying skin and muscles have gone into what gangrenous state and it is caused by the alpha toxin that is what lecithinase toxin of the Clostridium perfringens pain and characteristic capitis are the characteristic. Anti-alpha toxin is of great value for the gas gangrene. Now, coming to the next question. Mechanism of action of the titanospasmin is what? Inhibition of the GABA release or inhibition of the CAMP, or the inactivation of the ACH, or the inhibition of CGMP. So titanospasmin, how it will act? So easy one, mechanism of action of the titanospasmin. Now Clostridium tetani. Clostridium tetani has two types of toxin. That is, one is for titanolysin and एक और दूसरा कौन सा होता है टिटेनोस्पाज्मिन. ठीक है, टिटेनोलाइसिन तो फालतू का है because it doesn't have any role in the pathogenesis. Titanospasmin is what causing spastic, नाम से spastic paralysis. Okay, it causes a spastic paralysis, and that is by inhibition of the inhibitory neurons, that is glycine and GABA. Okay, so this uncontrolled involuntary contraction causing for the spastic paralysis. And what is the most common first appearance symptom? That is a lock jaw or the trismus. Complication: rhizus sardonicus and opisthotonus. Now, mechanism is what? Presynaptically act करता है, inhibits the glycine and the GABA release. Now, coming to the next question, which of the following is false for the tetanus? That it produces the heat-resistant spores. Person-to-person transmission doesn't occur. Incubation is what? 6 to 10 days. And 3 doses of the primary vaccination is protective. So which of the following is false for the tetanus? Produce a heat resistant spore. Clostridium, although the spores of the Clostridium are they what? They are resistant up to 100 degrees Celsius, but Clostridium tetani and the Clostridium perfringens, they doesn't, the spores doesn't destroy at around 100 degree Celsius. They need 121 degrees Celsius for its destruction. Okay? So they are what? Heat resistant spores. This is true. Tetanus ka in common, even if it doesn't know, we know that tetanus doesn't spread from one person to other person. This is also true, and the incubation period is what? 6 to 10 days. All right. Now, according to the NIS National Immunization Schedule, primary dose of immunization includes 3 doses of the DPT at 4 to 8 weeks, followed by the booster at 16 months, followed by the another booster that is around 5 to 6 years. All right. Now, other options we have already discussed about. Which of the following, which of the following is a dead end? Just a second. Which of the following is what? A dead end infection, that is a tetanus, or the vibrio, or the staphylococcus, or that hemophilus. So which of the following is dead end infection? So, which of the following is a dead end infection? Easy one. Dead infection मतलब कि man is the dead and host, and after the man the further infection is not taking the place. ठीक है. So tetanus is what the dead end infection, tetanus. But when we talk about the vibrio, it can spread to the fecal oral route. For the staphylococcus, same that it can spread it. Similarly for the hemophilus, but tetanus is a dead end infection, doesn't spread from the one person to another person. Now, tetanus is non-infection. There is no man-to-man transmission. Men act as a dead end, and other all are transmitted carriers. That is fecal-oral route by the vibrio, staph by the skin, and the hemophilus by the nasopharynx, because nasopharynx nasal carrier are present in the hemophilus. Next, coming to the next question, what is the site of action of the tetanus? That is, it is the pre-synaptic terminus of the spinal cord and the post-synaptic terminus of the spinal cord, and neuromuscular junctions or the muscle fibers. So easy one, site of action of the tetanotoxin. Now, two toxin we talked about. One is tetanolysin, another is what? Tetanospasmin. So tetanospasmin is responsible for all the violence that we see in the tetanus, and what is the main site of action? It is what? Brain stem. एक तो brain stem, and that is another is what? Spinal cord. ठीक है. And it is what? Ascending, and we see the ascending axonal transport in where? In the toxin. ठीक है. We see the ascending axonal transport, and what does it do? It actually synaptically inhibits the release of the inhibitory neurons, that is the glycine and the GABA. So it acts as presynaptic. For when we talk about the another toxin, they're the Clostridium botulinum. When we talk about that toxin, it acts presynaptic as well, postsynaptic as well as at the neuromuscular junction, and it blocks the release of the acetylcholine. वो क्या करता है जो पोस्ट सिनेप्टिकली जो बाइंडिंग साइट होती है ACH की, ठीक है, बाइंडिंग साइट जो होती है ना ACH की, उनको क्लीव कर देता है, so that ACH doesn't is not able to act, and it causes what? Flaccid paralysis. Now, tetanospasmin blocks the release of the inhibitory transmitters glycine and the GABA at the CNS and the presynaptic membrane terminals of the spinal cord. The manifestation is tetanus poison are similar, except tetanospasmin acts for presynaptic terminal, while stauroxetine that acts post-synaptic terminals. Now, the following statements are true about DPT vaccine, that aluminum salt, except an aluminum salt has an adjuvant effect. Whole kill bacteria of bottle of purchase has an adjuvant effect. Presence of the presence of the acellular purchase compound increases its immunogenicity, and presence of the H influenza type B compound increases its immunogenicity. So which of the following statement is not true? Now we know that the aluminium has a major role in the adjuvant of the effect of the vaccines, and the Bordetella pertussis also has an adjuvant effect. Uh, some options might be confusing, but when we read about the vaccine and the DPT vaccines, we read that the presence of the H influenza component doesn't increase the immunogenicity. Now, true about the tetanus. True about the tetanus is what and PJ question. So. Multiple choice will be correct in this case. Gram-negative spore-forming organism and produces a tetanus spasmin. Trismus and the neck stiffness are the early sign, and generalized tonic-clonic seizures occurs in the hyperstimulation, and the wound debridement is necessary. So, which of the following is true in this case? So which of the following is true? Coming to each of the options one by one. Now, tetanus is what? A gram-positive spore-forming organism. Now, produces what? It produces the tetanolysin. Tetanospine is true. Trismus and the lockjaw, neck stiffness are the early symptoms. Okay? Early sign symptoms of the tetanus. Generalized tonic-clonic can be stimulated because a person is in sustained contraction for a long period of time. Alright, and wood debridement is necessary because clostridium is what obligate and aerobe. Okay, it is an obligate and aerobe, and we have to reduce the conditions that is promoting the favorable conditions for the obligate and aerobe, and creating the anaerobic conditions. And anywhere where wound first the appropriate treatment for any wound is first doing the removing the necrotic materials and doing the debridement, and we do same for the gas gangrene as well. Now, true about the Clostridium tetanus is what? It is a gram positive, and it is drumstick appearance, grows in the aerobic environment. It is gram negative, and the E toxin promotes the GABA release. So what is true about the Clostridium tetanus? Again, this is multiple choice one. So easy one. True about the Clostridium tetani, it is a gram-positive. Yes, they are gram-positive spore-forming bacteria. Drumstick appearance, we are talking about the spores. The spores are terminal. The spores are terminal and circular in case of the Clostridium tetanus, that is as if of the drumstick appearance. And tennis racket kismet, Clostridium difficile and the tertium. It grows in the anaerobic environment because it is an obligate anaerobe by the mnemonic A, B, and C, that is actinomyces, bacteroids, and the Clostridium. It is what? Gram positive, and it inhibits the glycine and the GABA release, that is inhibitory neurons. Now coming to the next question. Coming to the next question, a 10-year-old boy following the road traffic accident presents to the casualty with contaminated wound over the left leg. He has received his complete primary immunization before preschool age and received a booster dose of DT at an early school entry age. All the following can be done except the injection of the TT, injection of the human antiserum, broad spectrum antibiotics of wound debridement, and the cleaning. So which of the following is cannot be done? Now injection of the TD. Now when the wound has been contaminated, the basic appropriate treatment is the wound debridement and the cleaning along with the antibiotics to promote the further infection, and an injection of the TT and the injection of the tetanus toxoid. Now coming to the next one, person has received complete immunization against the tetanus 10 years ago. Now he presents with a clean wound without any laceration from an injury sustained 2.5 hours ago. He should now be given the full course or a single dose of the tetanus toxoid or the human TT globulin or human tetanus globulin and the single dose of the toxoid. So what will give now he presents with a clean wound without any laceration. So he is present with a clean wound without any laceration and he has received a complete immunization just 10 years ago. So we'll not give the full course, we'll give out the single course, we'll give a single dose of the tetanus toxoid, we'll give a single dose. The most effective way of preventing the tetanus is what? The surgical debridement or the hyperbaric oxygen, antibiotics or the tetanus toxoid. So what is the most effective way? So easy one, the most effective way, as I told you, the most effective way of preventing tetanus is what? Is first treatment for any, the most for preventing tetanus is what? Because the question is asking the prevention of the tetanus. So why we'll give the hyperbaric oxygen before the tetanus has taken place, and why we'll do the surgical debridement, and why we'll give preventive antibiotics before? So we'll give the tetanus toxoid. Okay, that is pre-exposure, we'll give the tetanus toxoid. Now, the next question, the causative organism can be isolated in which of the following conditions? That is serum in toxic shock syndrome, meningococcal rash, rheumatic valvitis, or the CSF in toc tetanus, or the diphtheria, myocarditis. Okay, so this again PGI, so multiple options are true. The causative organisms can be isolated in which of the following conditions? What is the answer? We'll quickly just do the answer, question answer because it's already too late. This is what A and B. Now coming to the next question. Coming to the next question. Of the done to prevent neonatal tetanus except two TT dose to all the pregnant, TT to all the females in reproductive age, TT to all newborn, or penicillin injection to all newborn. What we do to prevent the neonatal tetanus in the unit. So what we do? We give what? Penicillin injection to all newborn, to all newborn. Now, three dose of the tetanus provide immunity for the 1 year, 5 year, 10 year, or the 15 years, or the 15 years. Easy ones, the three doses of TT provides immunity for around 10 years, for about 10 years. Wrong about Clostridium tetani is that main reservoir is the soil, human, and the animal intestine. Most common mode of transmission is trauma and contaminated wound. Herd immunity is not useful. The most common season is what? Winter and the dry season. So, which of the following is wrong? So what is wrong? The main reservoir is the soil, human, and the small intestine. This is true. The most common mode is the trauma. Yes, the tetanus is mostly it is what mainly acquired by the trauma and the contaminated wound with the spores of the tetanus. Herd immunity is not useful. Why herd immunity is not useful? Because it is not transmitted. The disease is not transmitted from one person to another person. Herd immunity हम क्यों देते ताकि ट्रांसमिशन की चेन को अपन रोक सके. Now it is a dead end disease. Clostridium tetanus is not transmitted from one person to another person to this from it is what not transmitted from one person to another person. It is a dead end disease. So why do we need herd immunity? We do not need because it is not useful. The most common season is not winter and the dry. It is actually the most that is mainly responsible and a favorable environment for the tetanus. Now, coming to the next question for neonatal tetanus elimination, the incidence should be less than 0.5 per thousand, less than 1 per thousand, less than 0.1 per thousand, or less than 10 per thousand. So for neonatal tetanus, the elimination is when the incidence should be less than zero point 0.1 per thousand or 1 per 10,000 live birth. Okay. Now, two more questions. Period of communicability for the tetanus is 7 days, 14 days, 21 days, or none. So easy one. Period of communicability is none because it is a non-communicable disease. It is what a dead end disease. It is a dead end disease, and there is no human to human transmission. There is no human to human transmission. All right. Now, come to the next question. A person has got a non-penetrating wound 11 hours back and he had taken complete course of the TT 1 year path. What treatment is recommended next is full course of tetanus toxoid or a single dose of the tetanus toxoid or nothing is required, a human TT globulin and a single dose of toxoid. What is that? Nothing is required. Okay? Nothing is required. All right, so I end up the session here. It's been already very late, although questions of the bacillus and this Clostridium are still left, and we'll cover in the rest of the sessions because Clostridium is such a huge topic, and so is the Corynebacterium diphtheria. The questions are majorly asked from these, no, these spore-forming bacteria, the bacillus and the Clostridium. We'll cover in the next session. So thank you for the today's session and do press the bell icon so that you can get the notification whenever you want to watch the video, and you'll get to know what lecture is live right now. And if you have access to the internet and you have that you are totally free that time to watch the live session, just do that so that you don't depend on the recorded sessions. You can download the PDF from the Unacademy Telegram and the Unacademy channel, this on the Unacademy app, and follow me on the Unacademy app as well. And do like, share, and subscribe, and use my code that is Muskan10 to get 10% of the discount. And use my code Muskan10 to enroll into the Unacademy, to subscribe into the uh, just to enroll in the Unacademy and to subscribe for the to take a subscription for the NEET PG or for the FMG or from the Unacademy. Just use my code that is Muskan10 to get 10% of the discount. Okay, so I'll see you in the next session, and I hope that you are preparing well and be safe right now. Just to take care of yourself, and since the malaria and dengue is spreading a lot, just take care of yourself and your health, and most importantly, your mental health. Just take care of yourself and have good sleep and good diet. Just maintain the consistency. That is the most important for any competitive exam, more than the how intelligent the person is. The consistency and the smart work will actually help you to attain your goal. All right, so see you in the next session. Take care until then. Bye bye.